Welcome to the Mama Stay Fit YouTube channel. In this video, we're going to be discussing what are the possible changes that could be occurring during your pregnancy, especially stretch marks, and what you can do about it. Hi, I'm Roxanne. I'm a certified nurse midwife, and in this video, we're going to be discussing all of the different changes that can occur to our skin during pregnancy. Some of them very common, very normal, and some of them may be a little bit more concerning. To start, our body changes during pregnancy. One, our growing body is getting bigger to accommodate for a baby, as well as our hormones are changing and our blood volume is increasing, leading to vascular changes. And all of these things can lead to changes within our skin. One of the most common symptoms associated with our skin is itching, and I'll go over all of the different reasons that itching may occur and what you could do for it. To start, we'll just go over all of the different things that can happen to our skin from all of those things, the growing belly, changes in our hormones, and our increased volume. So the first thing that could happen is hyperpigmentation. So this is increase of darkening within our skin, like the little marks along our entire body that can occur during pregnancy. And this is due to hormonal changes such as estrogen and progesterone, but it's also from more sensitivity from the sun. You can also notice on the face that you might start having darkening of the skin on the face, known as melasma as well. So these are all very common things that can happen, but things that you can do to either prevent it or prevent it from worsening are things where we're thinking about sun protection. So we're gonna wear daily SPF. We're gonna wear hats to protect us from the sun protection type clothing, and this will lessen the effect of that hyperpigmentation on our skin. If you're noticing that suddenly large areas are becoming hyperpigmented, this would be a reason for evaluation by a dermatologist. But generally, hyperpigmentation is a very common thing during pregnancy and not a reason for concern. Vascular changes, so things that involve our blood vessels, but things that we see, such as spider veins or varicose veins, can also be happening during pregnancy from that increase in blood volume that occurs. So this is a very common thing that could potentially occur for you. So things that you can do to prevent them is wearing compression socks or even thigh-high compression socks, as well as prolonged standing, avoiding doing that because then that is leading to more blood volume pooling within our lower legs. So the more that we're walking will also kind of help with blood flow. That is what the compression stockings are doing, as well as avoiding prolonged standing, especially in one position for long periods of times. Something else is when we're sitting and we're crossing our legs, that can also increase that pooling of the blood that can lead to spider veins or varicose veins. Because varicose veins, yes, most commonly occur in our lower extremities, but they can also occur on things like our vulva. So crossing our legs could potentially increase that risk because it's leading to pooling of blood kind of in that area, in that pelvic region. Other things that you can do to help just blood flow are massages during pregnancy that can be really helpful as well. Stretch marks are probably the biggest concern that people have about skin changes that occur in pregnancy. And most commonly, this happens on the abdomen, at the thighs, as well as the breasts from just the growing body that happens during pregnancy. It usually starts out a little bit more purple and then progresses to more white type stretch marks. And you may not notice it necessarily in pregnancy, and you may notice it more postpartum after the baby has been born because, one, you can't really see the lower half of your abdomen usually when you look down, so you may not notice it as much during pregnancy and then notice it a little bit more once the baby has come out and you're able to see the lower half of your body a little bit easier. For stretch marks, there is no evidence that any creams are going to help decrease the stretch marks. No evidence to say cocoa butter is better or anyone is better at preventing stretch marks. So while using belly balms and belly butters can feel very nice in the moment, especially if you're starting to feel some itchiness from that belly growing, it is not necessarily going to prevent stretch marks. There are things like retinoids that could potentially help decrease or reduce the stretch marks that you're seeing, but they're not recommended during pregnancy, so that would be something that you can discuss for postpartum care if you do develop stretch marks. The exact cause of why some people get stretch marks and others do not is kind of multifactorial and it's not fully understood. It could be just genetics. So you just genetically have a predisposition to develop stretch marks easier. It could be collagen related within our body. It could just be hydration status. So if you're a little bit dehydrated, your skin needs moisture and hydration to be able to stretch a little bit easier. So if you're chronically dehydrated, that could increase that risk of stretch marks potentially. It could also just be the size of your baby. So how much weight you gain and how much like your belly needs to stretch to accommodate a baby could also increase that risk of stretch marks. Gina has no stretch marks. I do. So like we have the same parents, but our bodies are just a little bit different. So just know that it could be just luck of the draw that you develop the stretch marks, unfortunately. There are some things that you can do postpartum, but nothing proven during pregnancy to prevent them from occurring. But your skin can feel very itchy when they're occurring, or just like the stretching of the abdomen and the growing of the abdomen can feel really itchy. So moisturizers can just be a comfort thing that can make you feel a little bit better while it's occurring during pregnancy. And in the postpartum, you can work with like a dermatologist or an esthetician to kind of decrease the appearance of those stretch marks if you desire. Just to review the very most common things that happen due to hormonal changes, increase in blood volume, and then just our growing baby that can occur to a large population of the people are hyperpigmentation, so darkening of our skin. You might develop just like almost like freckled-like dots all over your entire body. You might develop melasma, and then that linea nigra between the belly button and pubic bone that can develop during pregnancy. The second thing would be vascular changes, so like spider veins, varicose veins increase from that increase in our blood volume. And then the last one that can occur is stretch marks. And this is just from that growing belly and growing body from accommodating our baby due to different things. One person may be more at risk than others, but it's really multifactorial and we can't really identify who's going to develop stretch marks. And then there's also no treatment that is going to prevent them during pregnancy, but can potentially decrease the appearance in the postpartum. So those are the most common things that can occur and are non-concerning. Then there are things like itching that can occur, itching of the skin. This symptom is very commonly reported in pregnancy, but it can mean different things depending on the reason you're having the itching. So the most common reason for itching and most common rash that can develop during pregnancy is the PUPP rash. And this is what PUPP stands for. It's a really long name. So basically this means that you have red, raised, hive-like type rashes, usually on your belly, thighs, buttocks, and this will eventually all merge into plaques. And it's very itchy. But with the PUPP rash, it is sparing of our belly button area. So that area does not have the rash typically, and that's one of the things that we look for to see if it is the PUPP rash versus another type of rash. And with the PUPP rash, it usually doesn't occur until about the third trimester, and it will start within our stretch mark areas that we have. So that is why usually on the abdomen is where it'll start. This has no concern for baby, has no effect, so it's benign for baby, but it can be really uncomfortable for you with the itching. So things that we can do is we can provide steroid creams, so you can use other creams to kind of help decrease the rash, and then you can try like antihistamines like a Benadryl to kind of decrease the amount of itching that you're experiencing, and then cold compresses can sometimes also feel really nice on that rash. If you start developing a fever or blisters within that rash, or you're starting to have like full body response, like you're starting to get sick, those would be reasons to reach out to your provider and potentially require a referral to like a dermatologist. But this is the most common rash that people develop in pregnancy, like 1 in 200 people will experience this. And again, it occurs in the third trimester versus the other type of rash that can occur during pregnancy known as atopic eruption of pregnancy. And this can occur in the first or second trimester most commonly. It still has no effect on baby, but this rash is not just contained to your abdomen or your thighs. It can erupt anywhere, and it looks very similar to like an eczema type rash. Versus another type of rash that can occur in the first and second trimester, and this rash is not contained to just the abdomen and thighs, and this is known as the atopic eruption of pregnancy. And this is a rash that can develop all over the entire body, again, in the first and second trimester. Treatment very similar to a PUPP rash with steroid creams, moisturizers, cold compress, anything to reduce the itching, but it is contained kind of first and second trimester, and all over the body. It is not as common as the PUPP rash, but still a common rash that can occur during pregnancy. The other 3 things that can occur due to itching during pregnancy are a little bit more concerning. For the first one, we're going to discuss ICP, or itching within the palms and the soles of our feet. If you're having itching of your palms and your feet, this is definitely a reason to reach out to your provider, because that can be a sign that something is going on with your gallbladder and you need to be assessed. I will discuss a lot more in depth on ICP, or intrahepatic cholestasis of pregnancy, in another full-length video that we'll link in the comments below once it's released. Another type of rash that can occur that is concerning and does have some risks for baby is this rash. And this rash is an autoimmune response. So our body is responding in some sort of way to the pregnancy that is leading to this rash. With it though, how we identify it differently from the other rashes is that it does not spare the belly button area, and it can usually start at the belly button area and spread out. It's very itchy and it usually forms into like a boule. And it may recur throughout pregnancy. So it'll appear, go away, and then it may occur again later in pregnancy. If this does occur, usually using some sort of steroids, but a referral to a dermatologist to be managed during your pregnancy is recommended. And with this rash, since it is autoimmune related, it can lead to things like baby being small for gestation or even preterm birth. So if you notice a rash around the belly button that's really itchy, that would be a reason to reach out to your provider and possibly get a referral to a dermatologist to be managed. And then the last rash is pustular psoriasis of pregnancy. And this is very similar to that psoriasis type rash that can occur. This is super rare, but it's painful, and you usually are having systemic responses. So different than the PUPPs, because with PUPPs, it's just a rash, no systemic response, no fevers, whereas this one, you could have a systemic symptoms associated with it. So if you start noticing painful blisters and there are painful pustules or rash within your body, definitely reach out to your provider. While rare, we do recommend seeking care for this type of rash. So just to recap the reasons that you might develop itchiness or rashes during pregnancy, the most common is the PUPPs rash, and this is just red-like, hive-like rashes that eventually will form into plaques. Spares the umbilical area, so belly button area does not usually develop that rash. It will start usually within the stretch marks and then slowly spread. We usually treat this with some steroid cream, and then you can use like cold compresses as well as antihistamines and then some creams to also decrease the amount of itchiness that you're experiencing. It usually occurs in the 3rd trimester versus the atopic eruption of pregnancy can occur in the 1st and 2nd trimester, and this is a full body type rash. It can occur anywhere on the body. Treatment is the same. With both of those rash, there is no risk to baby if they develop, versus the other ones. So the first one is ICP, or intrahepatic cholestasis of pregnancy. This is itchiness of the palms or the soles of the feet. This can relate to the gallbladder. This does have an increased risk associated with stillbirth, but I'll have a whole video on this I will link once it is released. The other one is the pemphigoid rash that can occur that is an autoimmune response that starts around the belly button and slowly spreads. It does have an increased risk for a baby that is small for gestation or potentially preterm birth, and does require a referral to dermatologist to kind of be like worked with. It may reoccur during pregnancy depending on when it starts. And then the last one is pustular psoriasis of pregnancy. Super, super rare, but it's painful pustules and then also systemic responses. So fevers, body responses to this, and this definitely requires a dermatology referral and to seek care. And if you listen to this on a podcast, we do have pictures of what all of these different rashes look like within the YouTube video if you want to watch that. So just to close, lots of things can happen to our skin during pregnancy with hyperpigmentation, stretch marks, and vascular changes. This can cause changes to our skin as well as cause the most common symptom of itching, which is a rash or not a rash during pregnancy. So common skin changes are those hyperpigmentations, it can be stretch marks, it can be vascular changes such as spider veins or varicose veins, and those things are just happening very routinely in many of our bodies during pregnancy. Whereas the itchiness doesn't occur to everyone, but is also a common symptom that we'll want to investigate. It can range from a rash that occurs in 1st and 2nd trimester over your whole body, just your belly button, or it could be a more severe rash that requires referral out. So if you have itching at all, bring it up to your provider because they'll ask specific questions and look at your rash to be able to make sure that it's not something more concerning, and also be able to help you with the itchiness with maybe some steroid creams or other treatment options that they can discuss with you. If you had any of these skin changes or specific rashes during pregnancy, let us know in the comments below. And if you're looking for more support during pregnancy, check out our online childbirth education course where we discuss all of the science of labor and birth so that you can feel confident and empowered during your labor and birth. Within the course, we discuss what is happening throughout labor with the labor timeline, as well as birth options, how to prepare postpartum, and different comfort measures that you can possibly use during labor as well. And you can check out any of our courses at mamastayfit.com. And as a thank you for watching this entire video, you can use code YouTube10 for 10% off.